When I was little, my dad used to take me into the hospital with him in Vietnam. So I grew up in the healthcare field, and I never think that I would grow up and have any sort of health problem.
It just didn't even pass my mind that I could have anything that serious.
I was having some chest pain.
It was shortness of breath I was getting. I was having difficulty with my breathing. Yes, I was walking slower, and I just thought, I don't have to walk fast, I'm retired.
Dr. Muthaya, he said that my artery was 90% blocked.
I had a total of 5 blockages. Another artery had taken over completely because it was 100% blocked.
He recommended that I have an open heart bypass surgery.
Other people that I don't even know personally have open heart bypass surgery, not me.
I realized how caring other people are at Pomona. I could never forget that.
I never felt that I was alone.
It's not just the professional care, it's the human touch. It's the caring of the people that I will remember forever.
The origin of the Stead Heart Center goes back to the early 80s. There were cardiologists in the community and internists that had a vision that our community needed to have nationally known quality of health care and cardiac care that would be available to anybody in any community.
Then I started my practice in 1981 at Pomona Valley Hospital. At that time, there were no facilities for any cardiac care. We used to transport the patient to St. Vincent.
He had to travel downtown LA to do a lot of the procedures on many of our patients, and our patients had to travel the 30 miles to have care. And that really led us to making the contribution in starting what we now call the Stead Heart Center.
My name is William Stead, but my friends call me Bill. I was born in this hospital 85 years ago. I've had an opportunity to watch it grow, and I've been happy with the way it has grown.
Bill and Carol Stead graciously gave in his father and mother's name a donation to the hospital that's made the Stead Heart Center possible, and their ongoing commitment and gifts have made this program possible. We're very proud and honored to be recognized by Healthgrades with 6 Cardiac Excellence Awards, including 3 as America's 100 Best Hospitals for cardiac surgery, coronary interventions, and overall cardiac care. Healthgrades is a consumer-based organization that rates and compares hospital services and programs. It probably is considered the gold standard of consumer healthcare information.
It's a good, solid report card for the benefit of the community in judging and measuring the performance of the local hospital and cardiovascular care that's provided. And I think we as a program seek out those industry markers to make sure that we're either meeting or exceeding those standards. We set a pretty high expectation to exceed those standards, and we appreciate it when organizations such as Healthgrades comes back and tells us that we're meeting our mark.
That Healthgrades rating is reflective of the high-quality perioperative care that the patients get here at Pomona Valley Hospital.
You know when you come in as a patient that you are going to be well taken care of at the highest platform there is, from the physicians to the nurses, right down to the exercise physiologist.
Every patient, I treat it like it's my family, like it's my mom coming in or my sister coming in. So I think that's what we do with every patient.
We take the time to sit down and get to know you as a family member, because in order for you to get well and to progress through the program and to live your life to the fullest, we want to make sure we meet all of your expectations and what your needs are.
I feel so appreciative of the care that I was being given. They take really good care of me. And everybody was so human, so caring. I wasn't just a number.
They're just so caring. I felt like everyone was not looking at me like I'm just another bypass, just another open heart. You felt like you were getting the care and the attention you needed. It wasn't just one more patient and then I can go home. I never felt that way. I felt like they really had an investment in me, that they cared about what they were doing. It wasn't just a job.
I was a chemistry biology major in college, and I worked part-time at a hospital laboratory. And I learned that I really loved doing the blood draws and communicating with patients. And that's what kind of drove me. I really related well to the patients, and that's where I found my passion.
Ever since I was a little girl, I wanted to be a nurse because I was a patient when I was 6.
I've always wanted to be a doctor since I was 3 years old.
I was sick many years ago, and I was in ICU, and I made a promise that if I got better, I would find an ICU, and I would work at an ICU, and I would put my heart into it. Well, I got better, and to me, I was born again here at Pomona Valley Hospital.
This is a second career for me. I was a mom, and I decided to work as an intern here in the cardiac rehab unit, and at which time I found my passion. And I'm blessed because waking up every morning, coming to this place, working with these heart patients is the greatest gift that has been given to me.
People continually tell us about our heart center, and really Carol and I don't feel that way. We feel that we were lucky enough to give the hospital a tool, and the success of the heart center is the people involved. Their hands and their brains is what's made it successful.
The cardiac services program is really built around a team concept here, and it isn't one department or one individual, but rather the team.
We have the ER staff, we have the cath lab, we have cardiac surgery, we have the nurses in the intensive care unit and the telemetry unit, and then of course the cardiac rehab staff.
Everyone has to respond, and everyone has a role, and it's that combined collaboration and symphony, if you will, that comes together in the management of our patients.
It's easy to repair the heart. It's most difficult to change a lifestyle that they have been used to living for 40, 50, 60, 70 years. And we try to identify and create an awareness to the patient that these facets can all be modified over time.
I wasn't eating properly. I wasn't exercising. But when you have something like that happen to you, you have choices, we all do. But you have a choice to either do everything you can to make it a success, especially when all the people here were doing their best to make it a success. They don't go into it without giving it their best, and I knew that. I mean, they were so attentive and caring, and they were just there, and any question I had, they were answering it, and they were on it, and it was an amazing experience. But when I saw all that was invested in time and effort and their way, I thought, I can't do anything less than my best to recover. I didn't want to fail. I didn't want to fail them because of all they had invested in me.
We're here for the long haul. We're not just here to fix a problem, but we're here to make sure that everyone that comes through the program lives a long, strong, healthy life after receiving our care.
By Pomona having a very well coordinated program, being a STEMI receiving center, excellent heart surgery program, excellent cardiology interventional program, excellent heart failure program, neurology program, neurointerventional. I think the fact that we provide all these services in the hospital, and then we have an excellent outpatient cardiac rehab program, that we can not only provide the support and encouragement for the patients, but the tools in order to go through the entire process with a team support of the hospital staff and then come out being successful.
I think we're very well positioned for the future as a cardiac center, and as we go forward, we will continue to provide whatever services are needed, whatever technologies are advancing. This center will provide those services, in particular because of the support of the community.
I'm proud of our program, what we have here, and I'm proud of my cardiology colleagues, cardiac surgical colleagues, my nursing staff, administration.
It is an honor and a privilege to work with the community here of physicians and caregivers to give care to this community. I'm very, very happy to be here.
This program has such great potential. We've come so far in the last 15, 20 years that it kind of takes me aback a couple of times when I really stop to think about it. But the thing is that I always profess is that I really stand on the shoulder of giants. There is no way we could ever do what we do without the dedication and commitment and love that the staff provides our patients every day, every minute of every day.
I'm fortunate I was given a second chance, you know, and it's amazing. And I couldn't have done it without the people here. They're all a part of a big team, so that's very cool.
After you've gone through something like this, you know, you realize how short your life could be, and you just have to spend time with your loved one and make those memories and live your life to the fullest. Take time to know the people that you encounter in your everyday life, and just feel like I have given a second chance to know the people that God has put around me.